Linda Bloomfield. So Linda, it's all yours.
All right, thank you and good evening, ladies. Thank you for joining us. The Florida League of Women Voters works in conjunction with the Florida Voices for Health. It's a coalition, and our objective is to support Medicaid expansion in the state of Florida. Very briefly, I will remind you, there was a petition drive several years ago to put Medicaid expansion on the ballot. But our Supreme Court imposed so many rules and regulations on the petitions that the drive itself essentially died in its tracks. We're now looking, hoping, praying that Medicaid expansion will be legislated rather than a citizens' initiative. And our speakers tonight will certainly talk to you about that. They are here to talk to you about the value of Medicaid expansion for Florida, where we are in the process, and where we need to go. So it is with pleasure I'm going to introduce Diane Dimperio, who is our chairperson. Diane has worked for over 35 years now, developing and managing programs, providing health care and related services to Medicaid and other vulnerable populations. Programs served urban and rural, pregnant and preconceptual women, infants and children with special health care needs, as well as adults with chronic conditions. She has conducted community health needs assessments, done strategic planning, and helped to develop community coalitions. She has done this work for UF College of Medicine, Shands Hospital, the Florida Healthy Start Coalition, the North Florida Rural Health Network, and that was a mouthful, Diane, and the Department of Health. And she is, as I said, currently the leader of the League's Florida Healthcare Action Team and a walking encyclopedia of healthcare knowledge. And right next to her is another star here in Florida, not only for with women's reproductive health issues, but also with healthcare, Joe Shim. Joe joined the League on the Space Coast back in 2008 and has been working on the issue of Medicaid expansion for the last 9 years now, since 2012. And as you'll be able to tell as soon as she starts speaking, she's from the United Kingdom. She recognizes the value of both universal coverage and healthcare security, and that is why she continues to advocate for Medicaid expansion. In 1988, she graduated with a degree in clinical laboratory science from UCF and has worked in clinical laboratories in Florida and the US Virgin Islands. She currently works part-time for Johns Hopkins University, where we get a lot of our COVID information these days, by the way, in an international program that provides support for clinical labs participating in US-funded HIV and tuberculosis clinical trials. Joe is the current president of the League of Women Voters of Space Coast, serves as chair of the League of Women Voters Florida Reproductive Health and Justice Action Team. She's also a member of the City of Cocoa Sustainability Board in her spare time, and she enjoys running, traveling, reading, gardening, and spending time with her family, especially her grandchildren, a sentiment those of us with grandchildren can all appreciate. So as you can see, we have two shining stars leading us here in Florida. And on that happy note, I'm going to turn the program over to you.
Thank you, Linda. And thank you for your lovely introduction. Okay, so I'm going to start the presentation, and I'm going to actually explain to you how we got where we are and to give you a little bit of history. And then Diane is going to explain the current Medicaid expansion campaign, and then we're going to finish up discussing advocacy and what we can do to try and make it happen. So a few years ago, when I was preparing a presentation, I started looking at the history of basically providing healthcare for everybody in the United States. And it was really fascinating because not only has this initiative, this fight for healthcare been going on,
but they could not make it into this cycle. So a few technicalities that I need to get out of the way first.
Oh, I don't know where that's coming from.
Program for FY 21.
And they need to put their phone, they need to put on mute. Okay.
So, you know, this has been going on for over 100 years. And it's actually at different times, both parties have taken the initiative to try and get healthcare passed for everybody in the United States. So really began with Teddy Roosevelt trying to get universal healthcare passed. FDR tried to pass a program, and then Harry Truman. And Harry Truman tried in 1948, which was the same year that the UK got the National Health Programme that we all like to complain about, but really we're very proud of. So, and I actually, history-wise, I didn't know for a long time that it was actually contentious when it passed, but as soon as it did pass, it was well accepted. And then surprisingly to me, Kennedy and Nixon both campaigned on providing better health care. And of course, LBJ passed Medicare and Medicaid, one of the biggest that made, you know, tremendous difference for everybody in the United States. Nixon was still trying to get healthcare passed. He didn't succeed, but he did sign the HMO Act of 1973. And Nixon's interesting because he came from California, and that was the first state to actually have an HMO with, I think it started in the 40s with Kaiser Permanente. So, and then nothing really happened. We had Medicare and Medicaid, but nothing happened until the 90s when the Clinton healthcare, the effort to get insurance for everybody, a program where everybody got insurance, that failed. I think it was, the time just wasn't right. And then in between that and 2010, we had HIPAA, which introduced more patient privacy, and which was, I think everybody who was in healthcare can remember HIPAA coming in. Then Medicare Part D, which provided better prescription coverage. And then finally in 2010, we got the Patient Protection and Affordable Care Act. And as I like to say, it's never Obamacare to me, but I know sometimes you have to use that term so that everybody knows what you're talking about, but I usually call it the ACA. So then the ACA had passed, but it couldn't be, different parts of it were put into, were actually, you know, signed into law and put into operation. But before we could really get the ACA running, there were several lawsuits, and the Supreme Court didn't rule until 2012. So there were two really big decisions. The first was that they said that the ACA required the individual mandate, which required everybody to buy healthcare if they qualified, was constitutional, because it's only by having everybody in insurance that you can really make it work, because you need healthy people and people who aren't so healthy, so that everybody's paying into the system. They said that was constitutional. Since then, we've lost that. And I would say, as somebody who's helped some people with their ACA applications, because I did that for several years, I was actually pleased when that went, because it was hurting a lot of people who were just on the borderline of not having or having 100% of the federal poverty level. So, you know, maybe that will come back, but at the time it went away. I actually agreed with it. And then the really big decision they made was that states can opt, because Medicaid is a joint federal state program. They said that states can opt not to take Medicaid expansion. The states could decide whether they were going to take it or not. And to date, Florida has not taken it, and it's now one of only 12 states that has not taken the expansion. And of course, people paying federal taxes were all paying into that, but the money is not coming back to Florida. So 2015 was a really big year. A lot of things happened that year. So what I remember was, I don't know if anybody remembers Deirdre McNabb, who was the League of Women Voters Florida president for 6 years, I think. She made an attempt to, she got a nomination from the floor at the national convention, but didn't get in as the national president. But I was at that convention. It was very exciting. And she took the loss very well. But I remember her saying, this was 2014, and we're going to get Medicaid expansion in Florida. And I think that's what propelled the campaign, because a lot of people got involved in 2015. So there was a League of Women Voters that we actually had grants that year to help us. And but also the Chamber of Commerce was involved, hospital associations, SEIU. There was a real feeling that it was going to happen. The Senate president was Andy Gardner, who actually worked in the hospital system in Orlando. So he had a background in healthcare. And actually, part of his, Brevard was part of his district. And the same time, Steve Christofoli, who was running the House, was also from Brevard. So a lot of things were happening. There was a real thought it was really going to happen. We had postcard campaigns, we had social media, we did tabling, press conferences, we had panel discussions, and a few other things were happening just to make this. We even had our local foundation was involved in giving presentations, but there was the federal government to kind of push the issue, was telling states that hadn't taken Medicaid expansion that actually they were going to remove two things that actually helped Florida. Two pieces of funding. There was LIP funding, low income pool, that really helps hospitals when they are treating patients without insurance, and also another program called DISH, which also helped with that disproportionate hospital share. They threatened to take those away if the states did not pass Medicaid expansion. With Andy Gardner's leadership, it did pass in the Senate, but there was really no appetite to pass it in the House. But without the LIP and DISH funding, Florida's budget was going to suffer. And so before the end of session, I don't know if you remember this, I actually had to look it up this afternoon. The session ended 3 days early and the budget wasn't passed. And I believe they hadn't voted on the expansion at that time. And so there was a big uproar. Everybody had to come back for a late session. Rick Scott sued the federal government for discontinuing the funds. And the federal government actually they gave in once they had the lawsuit. I don't think they gave them all the funding. They gave some of them. Everybody went back. Finally, they did pass a budget, and we were very disappointed and absolutely exhausted at the end of that. So then I've just got a few pictures of, you know, things we did. We actually had a student, because we had a grant, we had a student intern helping us. We were all talking about the 51 billion that Florida wasn't taking over 10 years. We did our own brochures, we had panel discussions, and then we did Awake the State. That really wasn't the league, but it was all our local organizations. We did a Take the Money campaign. People who were supporting us had signs. This is Dina Levengood, who led the effort for the league. And this is Ethelene from Palm Beach County. This was actually at a Florida state chain conference. And this was outside Steve Christofoli's office. Actually, Anna Escamani was there, but I can't find her photograph, but I know she was there. So we did have fun with some of our activities, but we were very serious and we worked really hard, but the efforts failed, which brings us, and then nothing really happened, you know, in the background. Florida Voices for Health had been looking at different options. But in 2019, there was a new effort to do a ballot initiative, and this really got the League of Women Voters of Florida Health Care Action Team going again. We worked really hard on getting the petition signed, but ultimately the campaign failed. And I'll just add to what Linda Bloomfield said. Yes, it did fail because of the language, but also there wasn't really enough funding, and funding was a big issue to really get, is a big funding issue to get any ballot initiative passed. But that brings us up to where we are today, and I'm going to let Diane take over from me now.
I don't know, can I manage the slides? We'll see. Okay, so as Linda said, we're here today as part of the campaign to expand Medicaid expansion. And our goal is to do that in this coming legislative session. And we are working as part of a coalition. There's the League of Women Voters of Florida, Florida Voices for Health, Florida Health Justice Project, Florida Policy Institute, and a lot of other advocacy organizations. And so we're trying to educate and engage community members to be part of this effort to make sure people, you know, understand where their benefits lie, where their interests lie, and get them to put pressure on their legislators. There's been a lot of information that's been passed around, and I do believe a lot of our legislators are truly misinformed about the information. I think that there are certainly some politics involved, but I think a lot of the local people really don't understand, and it's up to us to educate them, because we have a lot of information now that we didn't have in the past. So we do have 2 bills in the Senate. Nice to know that people are fighting over us. We have 2 bills that are almost the same. 556 was submitted by Thurston and 698 was submitted by Jones. They both wanted to be advocates for Medicaid expansion. So that's the good news, that it's either of those bills that passes is essentially the same bill. I think they had to change one word to get them both accepted. And in the House, we have Nick Duran has submitted House Bill 341. So we have bills in both houses. I mean, yes, in both chambers, and that's a requirement for getting anything passed into law. So we've been anxiously awaiting, and we have those now. You want to, next slide, please, Joe?
Oh, I did click it.
Oh, I'm sorry. I guess I wasn't watching. I guess I was looking at you. Sorry. Okay, so what does this bill do? This bill expands Medicaid benefits, Medicaid enrollment to people that are uninsured, who are adults between 19 and 64, whose income is less than 138% of poverty. And just for sort of conversation's sake, that as an example, that would be a family of 3 that's making less than $30,000. Before the pandemic, that there were almost 900,000 people who would have met this criteria. And now we think that there's well over 1 million. Some numbers run as high as 1.6 million, but since we don't really know, we haven't really tried to put a high number on that. We just say over 1 million, okay? So who are they? I think this is kind of a misconception. So it's important that we understand who they are. For the most part, well over 70% of the uninsured that would be covered by this new program are employed people. They're self-employed, they own a small business, they work for a small business, you know, they're hourly workers in hospitality and construction. A lot of them have people at home that need full-time care, and they could never make enough money in their job to hire somebody to care for them, so they have to stay home. We know that there's a significant number of people who aren't actually enrolled in disability, but who in fact cannot really work because of health problems. They're more likely to be people of color. And so in general, these are the most vulnerable residents that we have here in Florida. Next slide. So the original concept of the Affordable Care Act and Medicaid, of course, being part of that, was that we want to make sure that people can be as healthy as they can. And we know that in America, that means having health insurance. You don't get health care, you get health insurance, and that's how you access health care. So Medicaid was the idea for getting health care for the low income populations. And now, as Joe said, most states have passed Medicaid. So the rest of this information is based on an enormous data bank that is, you know, very scientifically valid. So we know that people actually do enroll in care. They go to the doctor, they find out that they have diabetes, they find out they have hypertension, they get the medicine they need, they get the self-care information that they need, and they manage these conditions that can be managed. So they're not ending up in the emergency room and the hospital with strokes and heart attacks and asthma attacks, because they're getting preventive care and they're actually managing these conditions. Cancer, of course, is a little bit more complicated, but because people are going in for regular screenings, we're identifying cancer earlier. So people in states that have expanded Medicaid are coming in stage 1 and 2 cancer, whereas in places like Florida, the uninsured are coming in with stage 4 cancer. So obviously the worse the cancer is, the more expensive it is to treat. And also people really are going to suffer more if they're treating stage 4 cancer versus 1 or 2. Medicaid expansion saves lives. So we know that mothers and babies that live in states that have Medicaid expansion are more likely to be born, well, the mother's already born, of course, but you know, the baby's going to be born healthy. So we have higher rates of infant mortality and maternal mortality in states like Florida that haven't expanded it. Some newer data that I found really interesting was that if you look at that older tier, maybe not older than some of us, but the older tier of eligibility, 55 to 64, those folks actually are more likely to die if they live in a state that doesn't have Medicaid expansion. So the estimate is that every year 700 Floridians die unnecessarily because we haven't expanded Medicaid. And of course, we used to talk a lot about behavioral health, you know, opioid epidemic is on the front page. Well, now it's been bumped off the front page by COVID. But in fact, the opioid epidemic is with us and more serious than it was before, along with a whole cadre of other mental health problems that have arisen because of the pandemic. So behavioral health is really a huge unmet need in the state of Florida, and Medicaid provides comprehensive behavioral health benefits. And another thing that's been noticed in these studies of the impact of Medicaid on health is that it reduces the racial disparities that we see in almost every indicator. And we're going to go through that a little bit toward the end, but it doesn't eliminate it, but it significantly reduces the racial disparities in health outcomes. Next slide, please. So because right now we're all anxious about the fact that we got a $3.3 billion deficit looming in the fiscal year that begins July of 2021. So I'm really going to focus the rest of the benefits on the financial aspects, because it's really important, because a lot of people are saying, well, we can't possibly afford to expand Medicaid now because we have this big deficit. Wrong, wrong, wrong. That is wrong. This is the time to expand Medicaid now, because there's enormous financial benefits. So what happens is the studies find that if you were uninsured, you tend to rack up debt. No matter how hard you try, you're going to end up in the emergency room, and you're going to end up in the hospital. You can end up someplace where you have medical debt. And so it turns out that when you become insured, you pay off that medical debt. So you don't have the medical debt. So you don't have bills going to collections, you're not filing bankruptcy, and you can afford all those luxurious items like food, clothing, rent, utilities. So you're able to actually, start a life and get back on your feet. If you don't have your bills going to collection, you actually end up with better credit. And so if you say, for example, you have trouble finding a job that's on the bus line, well, guess what? You could probably even buy a car, and it turns out if you have better credit, you have lower interest rates when on a loan. So you have a lot more assets that you can employ to get yourself back on your feet. And it's funny because the original studies of evaluating the impact of Medicaid were based on state studies of their program. So like Michigan happens to be one for some reason I remember. And they interviewed a lot of people, and a lot of these people were saying, I can work now. I used to not be able to move the ladder, and now I can move the ladder. And some people had mental health issues. They couldn't leave the house, so they're like, yeah, I can get out. I can keep working. I can look for a job. I can look for a better job. And people can look for a job that doesn't offer benefits. So job lock means so many of us, at least I was certainly in that situation where I had to have a job that had the benefits. And a lot of people are in that situation. So if you can look for a job and get Medicaid expansion, Medicaid coverage, then you have a lot more flexibility in terms of your looking for a job. Next slide, please. So of course, now we're talking about, people are spending money in the community. So that's good for the community. And because the people that want to start a small business can get health insurance, they can start a small business, and then they can hire people, because when you're in small business, you're starting out, you're not going to make very much money. And so it allows people to really jump out there and become entrepreneurs, because they don't have to worry about buying health care. And it also turns out that if you look at the states that expand Medicaid versus those who didn't, that the rates of employment are higher, especially if you look at that population, that low-income population that's eligible for Medicaid. You see a significant difference in the employment rates. And this is not new information, but it's something I just learned. And it turns out if you have so many people that are in jail, and I just put this in the local one, but it's the truth for prisons too. So if you're in most of the, a lot of the people in jail, high percentages of the people that are in jail really have serious mental health issues, including substance use disorder. And so if those people get out and get into Medicaid, where they can get mental health services, medication, and the other services that they need, they're less likely to go back to jail. So you don't have that churning, and then obviously eventually that'll reduce the cost of incarceration, because you have less jail days. And you'll see in a minute, but all counties spend a lot of their tax dollars on indigent care, and that would not be eliminated, but it would be significantly reduced. And hospitals have less uncompensated care. So again, if you look at states that have Medicaid and compare them to those that don't, the states that don't have Medicaid, their hospitals are closing. A statistically significant difference. So Broward, there's so many people down there. I live in Alachua. We have more trees than people, but you guys got a lot of people down there. So you would have 80,000 people who before the pandemic were eligible for Medicaid. And we don't really know now, but we know that in November 2020 compared to November 2019, there are over 73,000 fewer people that are employed. So there's probably a lot of those people that have lost health insurance in addition to their job. Next slide, please. So I'm not picking on you because I did this for everybody. I did this for Alachua. So this is just to inform you about your county, not because it's a great place down there. You're pretty healthy, really. But the Broward Health System, which of course you're so lucky that you have such a progressive area that provides all these services. But over half of the emergency visits were identified as preventable if somebody had gotten primary care. So if you come in with, you can't breathe because you're asthma or you're having a, diabetic episode, well, those were preventable. They found that they provided $33 million in services for emergency room visits that were for people that were uninsured. They also documented $130 million in charity care. Those are people that were determined to be exempt from billing because of their income, but a total of $1.6 billion in uncompensated care every year. Next slide, please. So the county health department and the hospitals all do needs assessments, and usually they get together. But the Department of Health identified, and this is in spite of the fact that you have that really good healthcare system that gives care to people, gives access to care for a lot of uninsured people, still access to care. So they do surveys, random samples of surveys, and access to care and lack of insurance are identified as really critical issues among the residents of Broward County. And then if you look at all the outcomes, they sort of array them, best to worst. And if you look at Broward, that you're in the worst quartile, and this again, I picked out the ones that were particularly relevant to primary care. The worst quartile for people saying they have a personal doctor, people that got checkups, people that got pneumonia vaccines. So those are all things that would happen, in the primary care setting. But also you have a very high rate. You're among the worst quartile in the state for hospitalizations. Now we're talking about money again. Stroke, congestive heart failure, and asthma. So people are ending up in the hospital for conditions that could have been avoided with good primary care. Next slide, please. So we talked about disparities a minute ago. And so I've just listed some, and I'm not going to read them all off, but for every one white person, every one of these events in a white person, the number in parentheses is how many events that happens to a Black person. So for every white person that dies with a diagnosis of diabetes, 2.2 Black people die. So you can see the outcomes and this is totally typical. This is not unique. Now, some of the things are somewhat unique to Broward, but this is pretty typical throughout the state. But I just think it's nice to see your own data. Because it's just shocking, really, isn't it, to see the disparities in health outcomes. Look at infant death and maternal death. And we know that those numbers can be improved with Medicaid expansion. We got really good data on that because that's a short-term thing. That's a quick turnaround. So when you put in an intervention, it takes a while to see about asthma and diabetes and those things because they're sort of more global. But birth outcomes, they're pretty quick turnaround in terms of looking at the effectiveness of a program. Next slide, please. Okay, so here's the package that you need to tie up with a bow, because when your legislators, our legislators, go to Tallahassee, which of course they're up there now, but they don't really, they would say that they care about those other things, but what they're going to really focus on is the budget. So what you're going to hear is we can't afford to expand Medicaid, but that's not true, and I'm going to show you why. And you may know all this, but I'm going to go through it anyway. So regular Medicaid, the state always has to pay for a portion of the cost. Regular Medicaid, the state pays for 40% of the cost of services. Medicaid expansion, the state pays, this is state money, which by the way, they get from the counties partly, but let's just call it state money. The state pays 10% of the match. So if you bring in Medicaid expansion, what happens is some of the current enrollees, for which you're paying 40%, actually can qualify for the as defined as by under the definition of Medicaid expansion. So for example, pregnant women, when people get pregnant, if they're in expansion, they can stay in that. So that's just an example. So some people can be shifted from a 40% to a 10% match. Also, if you'll excuse me, but I think I'm talking to Broward County, so I can say this. As stingy as the state is about supporting healthcare services to indigents, there still are millions of dollars that are allocated at the state level for indigent care, both healthcare and mental health services. So that money can be eliminated because that's all going to be folded into the Medicaid program. So you're going to cut out all those budget lines of healthcare for indigents. And then it turns out that Florida cleverly bills healthcare providers taxes. So the more money they make in payment for health services, the more taxes the state gets. So if you'll go to the next slide, please. So if you roll up all of those switches, all of those pluses and minuses, you end up being able to pay the Medicaid match for the regular people and pay the Medicaid match for the expansion population. And you're gonna have, if you take that same money that you used to pay, you're gonna actually spend about almost $200 million less in state dollars to expand that Medicaid population. And remember, there's that 90% out there, right? So now let's think about that 90%. That's new money coming into the state of Florida. And it's estimated that that's going to be somewhere between 4.1 and 4.29 billion dollars. So that's going to be added to the state budget for healthcare. And you know what? You guys are going to get most of that. Dade County and Broward County are, I guess, apparently have the largest numbers. So, but anyway, that money's going to go into the state budget and the Medicaid budget, and it's going to be, paid out to people, to the providers for healthcare. And it turns out the economists tell us that if you get that kind of new money, you have a multiplier 1.5 to 1.7. So those people that have these new jobs or maybe have better jobs, maybe somebody is running a little beauty shop and now they can get a job as a med tech or something, so they're going to make more money. So someday, I just know someday we'll all be going out to eat again, we'll be going out to the movies, we'll be going out and buying clothes because we'll actually have somewhere to wear them. So there's there's a multiplier, so that's a 1.5 to 1.7% multiplier. So that $4 billion turns into $6 to over $7 billion, somewhere in that range of what they call economic activity. Now, this sounds too good to be true, but other states report these same findings. So this is, even though these calculations were done based on Florida's numbers, the experience is reflective of what other states report. So I think that's the last part of my slides. Let's see. I think Joe's up next.
Oh, no, it's you.
Oh, no. Well, this is my big summary slide. So I am calling Medicaid expansion COVID relief. So I think we need to, it's a COVID relief bill because people are desperate for healthcare. Oh my God, people are sick and there's these long haulers who are going to be sick for a long time. Some people are having organ damage. So not only are people going to get health care, they're going to be healthier, they're going to have better financial status. Communities are going to, they're hurting too, right? So they're going to be able to get back on their feet quicker because they're not going to have all the expenses that we just talked about. The incarceration thing, that'll take a little while, of course. But those little small businesses that have all gone out of business, I'm going to send you an op-ed that I just wrote, Linda and Joe. And I'm citing some of the small business data. it's really compelling. So this whole small business thing, so many of them have gone out of business. Some of them have paused. Some of them have really gone out of business. And these people are like, they need something to do. I mean, they need to start these businesses up again. So these people are going to be able to, you know, get Medicaid expansion. I mean, get Medicaid coverage and be able to get back out there and start those little restaurants and little bodegas and, you know, things that we just love when we're downtown. So, and it'll cut down our state tax dollars some, but more importantly, it's going to bring in this big bolus of well, federal stimulus. I'm saying $6 billion of financial activity, economic activity, and that's what we need. Especially when you think about last year's budget was $90 billion, $6 billion, or let's just say $4 billion in cash. That's a lot of money. It sounds like a lot of money anyway, but you know, putting it into perspective, that's essentially, you know, almost 5% of last year's budget. So it's a lot of money. So I think a Medicaid expansion is a COVID relief bill. No, I think that's all.
Okay, so we are asking you to help everybody in League of Women Voters, Broward County, to help us with this effort, and this will, you know, it will help to improve health and the financial status of residents of Broward and the state of Florida. So one new thing that we've been doing this year, working with Florida Voices for Health, is to pass resolutions in counties and cities throughout the state to tell the legislature that people in those areas support Medicaid expansion. And I think this, especially for more conservative counties, this is a really good tool. So now we can go to our legislators and say, you know, the people in this area really want this, you know, please look at it again, consider passing Medicaid expansion, get educated, and, you know, we can show that there's really strong support throughout the state for Medicaid expansion. So I know you've been doing really well. You have something ready to go to the county commission. But thinking about this today, our only success in Broward has been passing a resolution in a small city, but we're working on another Broward city. So you can do, the county commission is great, but you can also try some of your small cities in Broward if you've got the time and the you know, the time to put the effort into it. But I thought Plantation would probably be a good city to try. Oakland Park, because I know they're trying to get a reproductive rights resolution passed in Oakland Park. Davie and Sunrise, and maybe other small cities, maybe they would be open to passing resolutions too. So I'm just throwing that out as a suggestion. But then there's all the other things that we always do, speaking to our legislators, asking them to support following the progress of Medicaid expansion bills as they come to committee, and you know, responding to calls to ask our legislator, action alerts, to ask our legislators to vote in favor and support these bills. And of course, letters to the editor, emails, and you know, just even city officials, just letting them know what's going on and asking for their support. And I just sort of one thing, you know, when we're speaking to our legislators, and this happens to us a lot in Broward, but you'll go in and say, oh, I want to speak about Medicaid expansion, and they'll go, oh, Medicaid's a big program, and we have to make it smaller. And so what our legislators like to do is they like to consider the whole pie. And so that means the federal part of the program, as well as what the state actually puts in. And then they just, and of course it's huge, but it's not all state dollars. and as Diane said, a lot of them come from the counties and cities anyway, but that's the way our legislators look at it. So, and I think that educating our legislators is still something that needs to be done, because if they weren't around in 2015, I know from experience, they're not so familiar with Medicaid expansion. They don't know the history, and they have a lot to do, so they may not understand it very well. But with your help, I hope that we can pass it this year. And if not, I think that we should continue, because it's probably something that we just need to keep working on. But I hope we really see progress this year, and I know we can make a difference. So thank you very much. It's been a pleasure giving this presentation. And now we're ready to take your questions. And of course, we still have, if you are interested in this issue, please join Diane's healthcare, League of Women Voters Healthcare Action Team calls. The next one is going to be on February the 1st at 5 p.m. on Zoom. So do we have any questions?
Yes. Sandy Walter is asking if there's a draft municipal resolution. And Linda, essentially we do, because we have one that we have sent out to, Linda has sent out to county commissioners. So yes, we can do that. We can send you something, and I've got your email address, Sandy. Thank you.
So just
And there's also, sorry, Diane.
go
I was
ahead.
going to say Florida Voices for Health can help with getting some of those out as well, and putting in the figures. So.
Right. In general, though, the data that we have, so the resolution has, you know, the name of the organization that's supporting the resolution. The data that we have, just so you're clear, is data for the county. We only have data at the county level. But what we do is we just put the name of the city and then just use the county data. So you just have to be careful just to, you know, make sure your grammar is correct. If you take the county one and put the city name in it, you just have to be sure not to, you can't just cut and replace or what is it, edit, you know, cut and replace. You have to keep, yeah, you have to keep the name of the county in for the numbers. I mean, that's the little minor thing, but I've seen people do that.
Okay. Yeah, it is a Word document. You can edit it. I'll get it to you. Monica, you see any other questions?
Not in the chat, but we'll open it up. Just unmute yourself if you've got a question.
Hi. You said something about taxes from providers. I did not follow that. It sounds very confusing and I don't understand it. Can somebody elaborate about that?
Diane.
So when hospitals and doctors get paid for services, then like if you go to the grocery, even not a grocery store, but if you go to the clothing store and you buy a dress, then you pay for the dress and then you pay for tax, you add taxes to it. So when a doctor or a hospital brings in money from an insurance program or self-pay, then they are supposed to pay, if it's a hospital, 1.5%, you probably don't care what the percent is, but the hospital pays 1.5% and providers pay 1%. So they have to take the amount of money they get in, and then they have to cut off that amount of money and send it to the state. Is that clear?
Yes.
It's all very
So the more money they
complicated.
get, so that $4 billion is going to generate some amount. Some states didn't do that. So some states added, you know, a provider tax to when they expanded Medicaid.
I would just like to add,